Good morning, good afternoon, and good evening. My name is Rich Clark, a guide to the right path. So, today and this week, I'm going to talk about the topic OCD. And as a therapist, a hypnotherapist, psychotherapist, and CBT therapist, this is a problem I do deal with on the occasion for clients. So, what is OCD? So, it's obsessive-compulsive disorder, and it manifests in many ways. Here are the major types and how they affect the individuals. So I'm going to say the name and then the effects on the person. If you do want to know more, then please research up. So contamination OCD and the effects on the person are the following. The first one is excessive hand washing until the skin becomes raw and cracked. The next one is they avoid public places like restrooms or doorknobs. And they can spend hours cleaning home surfaces with harsh chemicals. They usually, in public, refuse to shake hands or touch items others have touched, and their daily life is restricted by avoidance behaviours. Now, in this, I am actually sharing a film from Throwback Thursday called As Good As It Gets, and this person actually suffers with contamination OCD. They also have the next one as well, called checking OCD. So the effects on a person is they're repeatedly checking that doors are locked, sometimes 20 times before leaving the home. They frequently return home to verify appliances are turned off. They're checking and rechecking work emails for mistakes before sending. They're usually chronically late due to repetitive checking rituals. There's sleep disruption from getting up to checking things throughout the night. Now, obviously, this can be very frustrating for these people, and they wish to work out why this happens. And it's usually from trauma from childhood, maybe there's a perfectionist syndrome or something like that. And this goes into the next one, just right, OCD, symmetry. So effects on the person is arranging items until they feel perfectly aligned. They're rewriting words or sentences repeatedly until they look right. They usually get stuck in doorways until stepping through feels correct. Also, they're being able to leave home until clothing feels properly arranged. They can also spend hours organising possessions in precise patterns. Now, this may be not harmful to others, but it's very much something which can be a deliberating issue for people. Now, the next one, which actually causes harm, is harm OCD. So the effects on the person is intrusive thoughts about harming loved ones, causing extreme distress. They avoid kitchen knives or potentially dangerous items. They're seeking the constant reassurance that they won't act on unwanted thoughts. They avoid being alone with vulnerable people, the children or the elderly, and they're self-isolation due to fear of their own thoughts. And then there's also this other issue, and I talked about this with perfectionism, negative mindset, and depression. And this also then goes into the fear of committing sin, which is the next one. It's called religious moral scrupulosity. And what this is the effects of the person is excessive praying to neutralize sinful thoughts. They're confessing minor or imagined transgressions repeatedly. They're avoiding religious spaces due to intrusive blasphemous thoughts. They're paralysing indecision from fear of making morally wrong choices, and they're performing elaborate rituals to atone for previous wrongdoing. Now, the next ones this is where people do get issues when it comes into relationships, which is the next topic I'm going to talk about, is dating, family, marriage, pre-marriage, and also pregnancy and so forth. So these will be the next topics I'll be talking about in the next few weeks. But if you have relationship OCD, these are the things you will have. Effects on the person is they're constantly questioning their feelings towards a partner. They're repeatedly asking for reassurance about the relationships. And this can actually be very difficult to deal with, because what you're doing with it makes the person question more, so makes them feel a lot more unstable or insecure. Comparing current relationships to past relationships or ideals, which is never probably a great thing to ever do. It pretty much can be the death of the knell of a relationship. Analysing every interaction for sign of problems, which is where we are overanalyzing or confirmation bias. Difficulty being present in relationships due to constant doubting. So when you're with someone like this, it can be incredibly difficult to work around. It can also be so frustrating, and actually most people within a few weeks, months, longer relationships, they usually quit them and try and find someone which doesn't give them problems. The next one is Puro, which is primarily obsessional OCD. So these are the effects on the person is mental rituals like counting or repeating phrases silently. And we hear this. So when you hear people, don't think when someone's doing mantras in meditation, that's not pure OCD, that's repeating a mantra. But there's certain things you will hear them sometimes repeat sentences or so forth, which is a form of autism. That's what it's seen as, but it can actually be a form of OCD. Affects the person is intrusive, sexual, violent, or taboo thoughts causing extreme shame. So the extreme shame also links with the religious issue, the fear of criticism and the fear of committing sin. So that is very interlined. And if you want to know about that, please watch The Fear of Criticism. It's a video I've shared on YouTube and other platforms. They're avoiding triggers that spark unwanted thoughts, which is sometimes very difficult when you're working as a hypnotherapist, because the triggers you have to work out to get over their thoughts or their problems or their cognitive behavior issues. Exhaustion from constant mental vigilance and rumination. So this kind of over rumination, overthinking is all these issues. And then social withdrawal due to fear others will discover their thoughts. So again, when people have got depression, also their medication can be changed. If they have mental health, this can also cause issues as well. So with OCD, it significantly impacts the quality of life, often consuming hours daily and causing substantial emotional distress. These compulsions provide only temporary relief, but creating a debilitating cycle that affects their work, relationships, and daily functioning. So if you feel you have any of these, or you want to know more how maybe I can help or give advice, please go to www.richclark.net. And if you book a free discovery call, and then we can discuss what that is, and we also would have to have your medical records to know what has been diagnosed and what hasn't, and then to work out whether I can work with you. If not, I can pass you on to the right people or give you some advice on where to go next. So until then, speak to you soon.